3 years ago, I could see the decline where I could tell it was getting harder to work in that, and then all of a sudden one night I just had an attack where I couldn't catch my breath out of nowhere, you know, and I got rushed to the hospital, and they sent a pulmonologist in, and that's when they told me I had, you know, COPD, and they called them exacerbations. I was having a lot of problems. It was like I was really down in the dumps, and this therapist realized it. And I was getting irritated that I wasn't getting straight answers, that these were being sugar-coated, I felt. And I wanted real answers to real questions. And this therapist, Linda, talked to me for quite a while and left. And then a while later, Sarah came up to see me.
One of the therapists, Linda Maynard, came down and asked me if I'd go up and talk to a patient who was upset and wanted to talk about end-of-life issues. And Linda thought about me.
I needed to talk to somebody. I was blessed that Linda brought Sarah into my life to just be real with me and talk to me. She talked to me for, you know, at great lengths. And then from that point on, we just kind of, you know, became, you know, kind of friends through emails. And
my husband was diagnosed with COPD about 7 years ago. He came in to the hospital and had a pulmonary function test, and I realized that there was something terribly wrong and had him diagnosed with a rare genetic disorder called alpha-1 antitrypsin deficiency. It's a genetic disorder that causes you to get emphysema at an early age. So that's why I always tell patients that you never know what you're going to get. You never know which genes you have until they've already affected you. COPD is this big bowl of vegetable soup, and there's all these different genes in there, and they all do something different. It just happened that my husband got this really rare one, and at 42 he could no longer breathe. So he lives the same life that Bonnie does. He's just in a different stage. Bonnie's a little bit more advanced. I have a whole different perspective on what my profession is based on the fact that my husband is going through the same process. It does make a huge difference. She's sitting here and everybody looks at her, she looks fine. She just has a tube in her nose with a little bit of oxygen and she looks fine, and I think that's just a misconception that because people look fine that they're okay, and it's not true.
You know, there's so many things that you don't realize go into this, you know, process of trying to catch a breath, and it's hard to explain to somebody. And I said, if I could do anything, one of the best educational tools I would think is for the government to take all these brochures, throw them in the garbage, take somebody like me, put me on a stage in a high school or a grammar school, and have me sit in a chair and then get up and then tell me to walk to the podium and address this class. To a kid, if they watched how I'm struggling, I would have to stop to breathe and stop to breathe and stop to breathe to get to that podium or to be able to tell them or answer their questions. And maybe 90% of those kids will think it'll not happen, but maybe one of those kids will think maybe that could be me, and maybe one of those kids will not pick up a cigarette. And I would be thrilled if one of those people was to do that. Just one person. There's good days and bad days. Now I have mainly the bad days most of the time. But I get to get up at 5 in the morning, and let's say by 5 at night. In that time, if I'm lucky, I'm able to get dressed and brush my teeth and wash. Have some tea and toast maybe for breakfast. If I'm lucky, get up, wash a few dishes. Every day I try to force myself to do something with my life. Iron maybe 2 shirts and maybe if I'm lucky I can make dinner, make a couple hamburgers. In 12 hours, it would be a good day, and it would really, really drain me and be very hard on me. And that's about all I could probably do in that 12-hour period. My daughter, and I'm not bringing this up for anything, has Down syndrome. She's 30 years old and lives in assisted living. She comes home every other weekend. Since she was a baby, whenever she went to bed, I always went in her room with her, gave her a kiss goodnight, turned off her light, and closed the door. Every single night she was here. And when she comes home every other weekend, I continued to do that. All of a sudden, one time, I couldn't do it. I couldn't get up and go in the bedroom and give her a kiss goodnight. And I said, you have to give Mom a kiss here. And it upset her because, especially with Down kids, you know, consistency is everything with them. And all of a sudden it changed that I wasn't doing this. And the hurt I saw in her eyes that I couldn't walk into that room to give her a kiss just tore me apart. That I wasn't able, and it made me realize what a horrible illness this was and what it was doing to me. And then when I can't go in the bedroom, she's even learned that it's hard for me to bend over. So she'll sit up in bed for me to hold me, give me a kiss, because she knows it's too hard for me to bend over to give her a kiss. It's my husband to put his arms, you know, to be held in somebody's arms, to feel that security, that warmth. There's nothing better than that. There's times he does that and I have to push him away because I can't breathe. And that hurt, that I can't hold him, that I can't grab my daughter, that I can't talk to my sister, my best friend, for an hour on a phone because I can't get the breath to do it. And I'm lucky. I have a loving husband and children and sisters and brothers and friends. I have people to help me where a lot of people don't have that support that I have. I'm so fortunate in that respect that I have the support of so much family to help me. And as awful as it is, I also am able to get my affairs in order, and I'm also able to say goodbye to people where a lot of people don't get that chance. Talking to Sarah just turned me around 100%. That talk just changed me and made me aware that I have to talk about it. I have to deal with it. I have to move on. I have to be realistic. We have to. And it gave me the opportunity that me and my husband could talk, and my son, so we could all be prepared. And I think that people need to do that. You can't close your eyes to this. It's not going to go away, and it's never going to get better. COPD doesn't get better. There's no remission. There's no nothing. There's nothing, but you're just going to get worse and worse and worse. And you have to prepare for that. The hospital this last time, I know I'm at the worst stage of COPD, but I said to myself, I'm going to push myself to the limits because I want to do as much as I possibly can. I don't know if I'll be able to. I want to go out and have a dinner with my husband one night. I mean, I can't tell you how many months it's been to just sit across the table from him and eat a meal in a restaurant. Your lung function is no longer a function, it becomes a job. I have to sit here and make this my job to breathe. And I am not going to sit here and stare at a blank wall and just say to myself, Bonnie, breathe. Breathe in, Bonnie, breathe out. Bonnie, breathe in, breathe out. That's what I'm going to do for 24 hours. I'm going to have no quality, nothing of life. I will not allow that to happen. You know, I don't want that to happen. You have to have some quality of life. There is no reason to have life if you have no quality. To sit there and do nothing, why? You know, what would you do? I wouldn't do that to my dog. You know, don't do it to me. at this point, I don't care if it's going to make me worse to push myself. Because they say, take it easy. I'm not going to take it easy. I'm going to push myself. I'm going to do anything I possibly can to make myself happy, my family happy at this point of my life. I mean, I don't know if I'll be able to, but I'm going to try. And I've never been a quitter. I've always, you don't know me, you don't know what type of person I am, but I've never been the type to give up. And I've always been independent and pushed, and I'm going to push myself and try to do the most I can. And I know at the end of my life is coming soon, and I'm going to do as much as I can before that happens.
Extraordinary people, extraordinary care.